Hello friends, welcome back to the channel. It's been a hot minute. This is ThisisTinuola. If you're just seeing this hot chocolate for the first time, hey, you're welcome. Right here, I share valuable content, so if you like the vibe, please subscribe down below. In today's video, I'll be sharing with you my experience having multiple huge fibroids in pregnancy. And the reason why I'm doing this video is because we just don't have enough conversations around fibroid. I personally used to think fibroid was more common in older women. I've heard of cases of older women having to do hysterectomy to take out their fibroids. But since I got diagnosed with fibroids, I realized that a lot of young women, young reproductive women, are having fibroid issues. This is, in fact, the most common non-cancerous tumor in women, especially black women. Some people are aware that they have it, some are not even aware of it because it can be asymptomatic and it can be symptomatic. In my own case, it was symptomatic and I got diagnosed in my mid-20s. I have another video I want to make regarding getting diagnosed and getting treated in Canada. That video is going to be slightly different and it might include me ranting a little bit about Canada's healthcare system because from the moment I realized that I had fibroid, I wish I had gotten treated early on and I didn't get the delay that I got until I got pregnant. This was like years after, despite the fact that I was, up on it and trying to get treated. But yeah, that's another story for another day. So let's come back to this video. What was pregnancy like for me having fibroids? I had about 10 centimeter fibroid and a 6.7 centimeter fibroid. The 10 centimeter fibroid, to put it in context, is like the size of a grapefruit. When it comes to fibroid and how it presents and how it affects different people, it depends on the location of the fibroid and the size of the fibroid. So our womb, which is our uterus, it has three layers. It has the inner layer where the baby is gonna stay. It has the middle layer, which is like the muscle layer. And it has the outside layer that is interacting with other parts of your internal organs. Fibroid can be located in any of these layers. It can also be located on top of the uterus and in the cervix, which is the bottom of the uterus. When you have fibroid located inside the uterus, which is called the mucosal lining, many people with those kind of fibroids, especially if it's big, have fertility issues. It's not all, but many people have fertility issues if they have that kind of fibroid. For people that have fibroid in the middle layer, which is the intramural fibroid, and the subserosa fibroid, which is the outside layer, they might have fertility issues and they might not. But miscarriage is definitely a risk factor for anyone with fibroid and other pregnancy related issues like placenta, previa, and so on. Let's not go too medical. So staying on the surface affects women differently in pregnancy. Some would have symptoms, it will affect them. Some it wouldn't affect them. For me, the fibroids were located in the subserosa and the intramural. It wasn't inside the uterine lining. I didn't have fertility issue in terms of conceiving. I could get pregnant. That was one of the things my doctor told me. She's like, you are fine, you can get pregnant. It's just that you might have miscarriage, and if you have it, you try again, blah, blah, blah. Oh, so let me not go into all that. But yeah, that was what my gynecologist told me here in Canada while I was waiting for the longest time to get my surgery done. The surgery I was supposed to do, because I'm a young woman trying to get pregnant, in Canada is called a laparoscopic myomectomy, which means they will take out the fibroids using a robotic machine. So instead of cutting your belly like a cesarean section to take out your womb and then scrape off the fibroid, they won't do it that way. It wouldn't be an open abdominal surgery. It will be them putting holes in your belly on both sides of your belly, putting a robotic machine inside to cut the fibroid and drag it out. Yeah, it doesn't sound fancy. I was a bit skeptical about how that was going to turn out. So anyway, I didn't get the treatment done. The other treatment options for me was to keep taking one medication that could shrink the fibroid, but as long as I'm taking that medication, I can't get pregnant because I'm not going to be able to have my period. And that medication also meant that once I stop it, the fibroid is going to grow back. It wasn't very practical, especially because it could only shrink the fibroid to about 50%, and it was very expensive. It's about $300 per month. The other treatment option I had was to reduce the symptoms I was experiencing, the heavy period. So she was going to give me a medication to lighten my menstruation. So those were the treatment options I was given. Surgery was definitely high on the list. That was what I needed to do to get rid of this fibroid. And the thing about fibroid is it can actually regrow. So some people will get treated with this fibroid, take it out, do the myomectomy, and it will grow back. However, this video is not to scare you. I'm sharing this video also because I had a pretty positive, very, very positive experience with fibroid in pregnancy. So if you are someone experiencing this or you know anyone experiencing this, relax. You'll be fine. You'll be fine. Just relax. There was one recurring advice when I was pregnant, and it was that you're going to experience a lot of pain, so get ready for it. I was ready for it. I was ready for the pain. I'm like, as long as my baby is fine, I'm okay. I'm ready for this pain. Let's go. Because I heard that advice all the time. The same period I was coming to Nigeria was when I found out I was pregnant. The abdominal x-ray, I got it done in Nigeria. I did the blood test in Canada a day before I traveled. When I got the results was obviously when I was already in Nigeria. My husband actually even called my attention to it that I was pregnant. Like, you've not seen your period. Because I wasn't experiencing any symptoms. I thought I was going to be that pregnant woman that will be throwing up, that will be keeping saliva in her mouth, that will be super sensitive, but I wasn't. In my first trimester, it was a bliss. Actually, the entire pregnancy was a bliss. When I got the positive pregnancy result, the radiologist that did the test was like, you need to be very, very careful with this pregnancy. Like, this is already a miracle for you guys. Not like it's impossible to get pregnant with fibroid, but like the fact that you have this baby, regardless of how big your fibroids are, just be very careful. This is a blessing. Make sure you take good care of yourself. And I also went to multiple other doctors. I went to about at least 4 or 5 doctors through the course of my pregnancy. More than that, actually. I did about 14 ultrasounds, because I was constantly keeping everything in check with the baby. And because of the fibroid, I needed to do a lot of ultrasounds. The doctors just wanted to see this and see that, and sometimes they'll say they couldn't hear the baby's heartbeat. I needed to go check it on an ultrasound, So there were just a lot of reasons why I had to do ultrasound. The recurring advice was, you're going to feel pain, make sure you take it easy, you need to observe bed rest. I love to take a walk, I love to swim. And they're like, no, this is the time for you to relax. This is the time for you to actually chill, especially for the first 15 weeks. You shouldn't be doing anything strenuous. Observe bed rest. Let's get past this 15 weeks. Let's get past this first trimester, enter your second trimester. Let the baby develop a bit more before you start getting super active. In terms of pregnancy symptoms, I didn't have so much aversion. I was very energetic in my first trimester. There was no throwing up, no saliva in my mouth, a bit of morning sickness. The taste of things felt a bit different in my mouth. The only food aversions I had was Maggi. I didn't want to put a lot of Maggi and salt in food. I also didn't want to use a lot of oil. First trimester, I did not experience any pain. My baby was growing fine. I was growing fine. The other aversion I had was towards screen. I just noticed that I really loved serenity, so I wanted to just read instead of watching any screen. I wasn't online. I just could not stand my phone. I just did not want to be around my phone. So most of the time, I wouldn't even put on my phone or be with my phone. There was no laptop. I wasn't with my camera either, because I couldn't stand those things, which is quite weird considering that I'm a content creator. It was December. I should be vlogging in January. I was supposed to travel back to Canada, but I had to postpone my ticket. When I saw the way I was being taken care of in Nigeria, the doctors were so familiar with fibroid. This is like something they eat and drink every single day. It's like, okay, yeah, we're used to it. We see fibroid cases all the time. I felt so comfortable with getting treated and getting taken care of in Nigeria, even with my pregnancy. Nigeria is the most populous black country in the world. Of course, we have the highest number of black women in Nigeria. And like I said, over 80% of black women have fibroids. So just imagine, being a doctor in Nigeria, gynecologist. This is something that you'll be like super used to. So I felt very confident with the healthcare system, with the doctors here in Nigeria to take care of me. My entire pregnancy was a bliss. I had a positive experience. My first trimester, I was eating a lot of fruits. I was constantly craving fruits, tropical fruits like mangoes, oranges, pineapples, watermelon, carrot juice, all of that. I had a lot of it in my first trimester to the point where I got ulcer, which was quite weird. I think it was pregnancy induced because I've never had ulcer before. So I got diagnosed with ulcer in my first trimester. When I got to my second trimester, I started having a bit more tolerance to screen. Still didn't have, the old severe morning sickness. Most people didn't even realize I was pregnant. I didn't look pregnant. I wasn't acting pregnant. I had a lot of energy in my pregnancy, except for third trimester shower when I got heavy. And because I felt like I had a lot of energy, even though the doctors warned me to be careful, there was a day I danced a lot. There was this party going on in my street and the music was just, the jam was jamming and I was just dancing. I danced so much and I slept off. I woke up at night to pee and I could not get up. That was when I first experienced fibroid pain in pregnancy. I have been told about fibroid pain in pregnancy that it can land you in the emergency room where they have to start administering those intravenous fluids, those normal saline. They have to administer it. I have heard of stories of people staying in the hospital for days because of fibroid pain. So when this pain came, it hit me hard. I woke up. I wanted to get up. I could not. The pain was dragging me. The pain held me. I wasn't sure it was fibroid pain at first because that's the first time I'll ever be experiencing this. This is also the first time I'm being pregnant. So I was scared. Initially, I thought it was miscarriage. So I was just praying. I'm like, God, hey, we've come this far into the second trimester. I cannot lose this baby. I was just... In that moment, I don't know what happened, but in that moment, I'm like, this is a spiritual warfare. We will conquer. But I'm being serious here. I literally carried my Bible. I was hitting my thighs. I don't know why. It was weird, but I was hitting my thighs really hard. I kept on hitting my thighs, and I kept on praying. This went on for about 3 hours. I could not sleep. I could not move. I was in severe pain. I could not even call anyone because I did not want anyone to panic. I also saw that I didn't have blood. So I'm like, this is probably fibroid. It's probably not a miscarriage. It's probably fibroid pain. The fibroid pain that I've been hearing about, that's probably what's going on right now. So I'm like, if it's for pain, I will fight it. As long as my baby is fine, I will fight this pain. Also, I already got a pro tip from a friend, a medical doctor that also had fibroid, and she's like, stay hydrated in pregnancy. When that fibroid pain comes, drink water. And to prevent that fibroid pain, reduce stress, rest a lot, drink water. Just stay hydrated. At least 3 liters of water every day you must be drinking. So I always, had bottles of water around. So I just kept on drinking water. So just hitting my thighs was distracting the pain. Kind of like when you're in the labor room and you are like distracting your pain, if you get what I mean. I did that for about 3 hours before I could get some sort of relief. And the relief I'm talking about is to be able to actually stretch my body and lay down. Or to be able to move around, but I still had that pain. It was still there. It was just a lesser amount of pain. I still had it. I had to bend. I had to bend my back while walking, so I was walking Anyway, I went to the hospital. I got prescribed some painkillers that were safe in pregnancy. It did not work. The painkiller did not kill the pain, but water helped time. It just made the pain reduce. So the pain went away after about 4 days. That was the first time I felt it. I did not have to get admitted in the hospital or anything like that. And then 2 weeks after, the pain came back. So the pain was coming on and off, and by this time I was already familiar with what it was, that it was fibroid pain. So I didn't panic. I was just staying hydrated. Whenever I feel the pain, I mostly felt the pain whenever I tried to force my energy, be active, lift up things. The good thing was I was in Nigeria. I had a lot of help. So I gave my body, a lot of rest. The pain gradually went away towards the end of my second trimester. Once again, I didn't have to be admitted in the hospital. There was no emergency. My second trimester, morning sickness reduced. I had more tolerance towards, using screen. There was nothing like crazy going on aside that pain. The ulcer was still there, but I was doing everything to avoid getting triggered with the ulcer, because that was the other thing I was experiencing. That's actually what made me go to the hospital more for treatment, the ulcer. Anytime I take ginger, orange, because the thing is, when I was pregnant, I would drink like 5 oranges at once. I was craving a lot of fruits. I was taking a lot of lemon too, because of the tiny morning sickness I was having. Anytime I feel like I'm feeling pregnant, I'll just start drinking orange. Like, what's going on with you, girl? And I was also very hot the first few weeks when I got pregnant, without me knowing that I was pregnant. It was already, winter period, and it was quite cold. One of the symptoms I actually had, which I didn't pay so much attention to, was my hands and feet were not cold. They were warm. Sometimes I'll be outside in the cold, and I'm someone that gets cold quickly, especially because I had anemia. I had slight anemia because of the fibroid. But yeah, I used to be very, very cold, especially when the weather is cold. But during that period of time, they were quite warm. No matter how much time I was outside, no matter how cold I was, my hands and feet, they were warm. Anyway, second trimester, I wanted to start doing shopping for my baby, to know my baby's sex. I went to do the scan to check my baby's sex. Every time they'll tell me my baby is hiding. The leg is covering. We can't see it. The bum is shooting out. It was so funny. I was pissed off at some point, because I'm like, yo, I need to know the sex of this child, because we need to start doing shopping. But yeah, I eventually found out the sex of my baby close to my third trimester. The most popular baby factory here in Nigeria was where I registered for my antenatal and gave birth. You guess it. If you know, you know. I think I'm going to do another video regarding my experience in that hospital, because it's a government hospital. I didn't expect to experience what I experienced. But yeah, I'm going to do another video regarding that. If you guys want to see, let me know down below. And if you know the hospital I'm talking about, comment below. My third trimester, I had less energy. My aversion for screen was definitely improving. I was following this Canadian nurse, Diana in the Pink. I was following her YouTube channel every week for my pregnancy. I had the pregnancy app. I was following it every week, every Monday. I'm like, okay, we are 10 weeks today. We are 20 weeks today. Oh my God, it was really... Pregnancy is so surreal. Like, I can't lie. Pregnancy felt good though. Forget it. People telling you that pregnancy will humble you. You can humble pregnancy. I remember there was a day in the hospital. I went to the pharmacy to get this anti-malaria thing. So if you are pregnant in Nigeria, you'll be taking anti-malaria medication like once a month, just to avoid malaria in pregnancy. I never had malaria in pregnancy. Every time they checked me, I was like 0 malaria. Great. That pharmacist was like, girl, are you sure you're pregnant? You don't even look it. Like, you are the definition of you humbled pregnancy. But yeah, you don't have to see pregnancy as something that will humble you. I feel like pregnancy can be very enjoyable for a lot of women, either you have fibroids or not. I had fibroids and my pregnancy still went on very, very, very good. Before I got pregnant a couple of years ago, I used to be so scared of getting pregnant and giving birth. I used to think, like, can I actually do this? Can I actually do this? It's too much. It's too complicated. It's too painful. It's too risky. I don't know if I can actually do this. But what I changed was to start watching positive pregnancy videos. I started watching positive childbirth videos, just trying to connect with everything positive about pregnancy. I'm like, my body was meant for this, blah, blah, blah. praying about it, just trusting in God for God's perfect timing. And to be honest, when I got pregnant, I wasn't trying hard to get pregnant. My husband and I weren't trying hard to get pregnant. At that point, in fact, our resolution was, let's just focus on this fibroid treatment, get it done with, and then start, pumping out babies. But as God will have it, God is the master planner, and I'm in awe of how He's executing His plan in my life, in our lives. So, yeah, you don't have to view pregnancy as something that would make you turn crazy, make you look ugly, make you feel crazy. Pregnancy can be a blissful journey, and that was what it was for me. It made me also value life more. Especially the childbirth. Woo! That's gonna be in another video. I'm gonna talk about giving birth in another video. Yeah, just watch out for that video. But yeah, third trimester, I did more baby shopping. I started my baby shopping in second trimester. Actually, baby shopping was even really quick. I picked a date, went to the place where I could buy wholesale baby stuff at affordable prices. I already had a list of things I wanted to buy, screenshot of things I wanted to buy, went into the markets with my mom-in-law and a friend, and we got, all the things I needed to get. It was that easy. Everything was just easy. After second trimester, I did not experience any more fibroid pain. The doctors that were checking me, they started saying, are we going to have labor or we are going to have CS? I wanted to do it vaginally because I'm like, I don't mind trying if I could. One thing I realized is that you can have fibroid and still give birth vaginally. It depends on the location of the fibroid. So because you have fibroid, it doesn't automatically mean you have to do CS. That's one thing I learned. But the determining factors for CS is, let's say the child is at risk. Let's say your fibroid is at the cervix. It's going to block the child from coming out. Or you have other pregnancy-related issues that can put the child's life at risk, like placenta abruptio, placenta previa. Also, if you've had previous CS or if your baby is in breech. Towards my EDD, at about 30 weeks, I started being, more proactive about what method I was going to use to give birth. And the doctors were like, just wait till you're 37 weeks because we cannot determine right now. We have to do ultrasound, keep monitoring the baby, check if the baby is in breech or not. But the baby was always, in transverse position. So they were like, maybe the baby will change to, head down position. My baby was always in transverse position, like this oblique position. Our head will be here, our body will be here, kind of like this in my womb. And that's because of the location of my fibroid. My fibroid kind of disturbed her. And oh my God, I'm getting emotional. What I heard some doctors say is if you're having a baby boy and you have a lot of pregnancy related complications, the baby boy might have a lesser chance to survive than a baby girl. I don't know how true that is. If you know anything about that, let me know in the comment box below if you've heard that before or you have any idea about that. But that's something I heard while I was pregnant. I was scared at some point, but I just felt like as long as it's God that has master planned this child and has put this child inside my womb, I will not lose this child by God's grace. I was just holding on to that faith till the end of my pregnancy. When I was preparing for labor, I was preparing to have vaginal delivery. And towards when I was about 35 weeks, because at some point I was going to the hospital every single week. So based on my follow-up results from the ultrasound and everything, the doctors were like, you know what? The fibroid you have at your cervix is so big, there is no way your baby is coming out through that cervix. You are going to have a CS. This was at my 37th week appointment. So the doctor said, when next you're coming next week, bring your hospital bag. You'll be having your baby. Because we have to do cesarean section for you 2 weeks before your due date. So we are not taking any chances in case you want to fall into labor. That was how I ended up having a CS session. I'm going to share with you guys what my experience was having a CS. session. That's the first time I'm ever going to have surgery in my life. And yeah, it was quite interesting. I'm gonna share that more in another video. This was my experience being pregnant with fibroid. I didn't have any crazy negative experience. Honestly, the pain wasn't even as frequent. It's different for different people, you know. It depends on where your fibroid is located. Once again, depends on the size of your fibroid. The reason why there's pain, especially in your second trimester if you have fibroid, is because the fibroid is growing, the baby is growing a lot more, and now they are competing for blood supply. So the fibroid might be dying off a little bit. It's called red degeneration. So it causes pain. Aside pain, aside risk of miscarriage, aside feeling like you're carrying twins in your belly when you're only carrying one single baby, because that fibroid too is growing, man. For some people it's growing, so for some other people it's shrinking. It depends on your body. All these things there, it just depends on individual experiences. I'm glad my experience was quite positive. If you are experiencing fibroid in pregnancy right now, there's no need to panic. Continue to trust that you'll have a positive outcome. If you know of anyone that has fibroid, you can share this video with them. So if you have anyone that is single that is experiencing symptoms of fibroid, go and get it checked. Get the surgery done so you can heal up fast and your body is ready for childbearing if you still want to have kids.